board, of course, we are looking at the country as it is and weighing in on some of the restrictions that we have as a country. Now, it's been an active weekend, particularly on social media, and this is in regards to the restrictions that have been put in place by government. And there are several counties that you cannot go out or go in unless you have special permission from government. And I'm going to just go through those: Kilifi, Kwale, Mombasa, Nairobi being some of those. And we had asked out the question earlier on: do you think the recently imposed measures restricting inter-county travel by government are effective? Do you think they are effective? And this, of course, is to underscore and highlight the importance of ensuring that we follow some of these restrictions. Joining me this morning to have this conversation is a governance consultant, Michael Ogwanda. Thank you for joining us. We are also joined by government spokesperson, Colonel Cyrus Oguna, who is on phone. Thank you for joining us, sir, this morning. But let me start by, first of all, reading some of the comments that have come through, because this is a question that we put out. And we have Wycliffe, who says, time will tell. The outcome determines the effectiveness. So, of course, and remember, we're at a very critical stage as a country where we are on the second month of having very many restrictions, and this could tip the scales either to improve or for it to get worse. We also have Collins, who says, this is Kenya. Let's wait and see. We also have Joska, who says, I don't think it is effective. I have somebody I know who traveled from Mombasa to Siaya despite the restrictions and had no special permission. Again, this is the situation. And I'll be reading some comments that I came across over the weekend of people literally who are almost chest thumping by virtue of the fact they were bragging how they've managed to cheat the system to do that. But let me start, first of all, with government spokesperson, Colonel Oguna. Thank you for joining us this morning. Maybe let's start by, first of all, highlighting why these restrictions are important and what we are likely to face should we not follow the guidelines given.
Thank you very much for inviting me to the show. Indeed, these guidelines are very important because initially when we started, observing these infections in the country, most of them were actually infections that were imported into the country. But increasingly, these infections started coming up within the communities. And therefore, in order to ensure that they are contained within certain areas, especially Nairobi, Mombasa, Kilifi, and Kwale, the restrictions were necessary, very important to ensure that cross-county movements are restricted so that the infections do not get out of one county to another. If that were to happen, then certainly we are going to have a very, very serious situation in the country.
Okay, and this, of course, was done rather abruptly, and there are those who feel that possibly it should have been given a lead time. Majority of the times when there are restrictions, you're given maybe a day or two for people to go back. Why was it done so suddenly?
Of course, it was not so sudden, really, as you want to put it. Of course, you do remember that the counties of Kwale, Kilifi, and Mombasa were given a lead time about 3 to 3 days. The county of Nairobi, indeed, previously, there was hints that were being made and people were being cautioned not to travel out of Nairobi, and the minister, the cabinet secretary for health kept on, trying to appeal to the people of Nairobi to stay in Nairobi. And he warned that in case they do not do that, then stiffer measures would be instituted. And indeed, that was kind of like a caution that something stiffer was actually underway. So it was not really that abrupt. If somebody was keen, would have noticed that something actually in the offing.
Okay. Now, I'm sure government probably did anticipate that this might face not necessarily resistance, but there are people who might want to try and shortcut for one reason or the other. What measures or what has government done to put in place to ensure that this is followed to and adhered to the letter?
These instructions and regulations and even measures that we put in place are actually measures that are aimed for the well-being of our people, not for the government. And I think that is where perhaps most of us are missing the point. This is not to protect the government. This is to protect the people of the Republic of Kenya. And therefore, it does not even require enforcement What this requires is a high sense of discipline, that for people to understand that this is for their own benefit. And therefore, if we begin to ask what measures were put in place, I think the question would be is that why are people not so disciplined enough to obey them, right? This is something that is designed to protect myself, to protect yourself, to protect your family, to protect your friend. Why would we want the government to enforce them? It should be self-enforcing. I should myself realize and understand the importance of obeying and complying to these regulations. And therefore, the high level of indiscipline that is being observed is something that is actually baffling. And we cannot turn around and say the government should have done this. It is, why are people not obeying this?
And maybe you'll tell us what government is doing, because evidently it is the human nature that we sometimes do not follow instructions. And I'll just read some of the comments that I've seen here so that we see the magnitude of what we're talking about. There is somebody who says, I've just passed, this was over the weekend, I've just passed roadblocks at Blue Post and I'm on my way to Nyeri and I'll be going back to Nairobi on Tuesday. Ndio nipite nipea hawa afande ile sadaka ningetoa church leo. That was on Sunday. We have somebody who says, the police are just bored. I drove from Nairobi to Makueni on Wednesday morning around 6 a.m. At the Small World roadblock, I had to identify myself to be led through while I was coming back on Thursday. Nobody bothered to ask me of my identity. I was just waved on. Is this something that you expected? Are you getting reports that possibly enforcers are lethargic about this?
Well, I cannot say that they are reports. Some of those things, of course, are fictitious. They're not necessarily, things that can be authenticated. But again, what we may want to ask ourselves is that why would somebody want to cheat? What is it? Because none of us knows who is infected and who is not infected. It is not something that you can tell that so-and-so is, before science begin to show. And therefore, when somebody brag that he moved out of, the confinement of Nairobi into other parts of other counties, it is something that demonstrates the high level of indiscipline that we have. Because when you're going out of Nairobi town and you don't know whether you are infected or you are, and you're going to meet other people that may equally be infected or not, or they are not infected and you're taking infection there, wouldn't you want to ask yourself why you're doing that? Is that really necessary? It's like, the CS keeps on talking about, like there's a hole and then you're jumping right into it. Right. And you've been told not to jump in. If you jump in that hole, yet you're saying it's a hole, would you blame anyone, honestly?
Absolutely. And maybe before letting you go, sir, question here being, what are we likely to see should this indiscipline continue? And I think it is important for us to let Kenyans know that really, at the end of the day, this is in our hands.
Indeed, it's not just, I think even you members of the press, the fourth estate, you have a role to play. And perhaps the bigger role you need to play is also educate Kenya. This is there for their own good. It's not for the good of the government. We have our family. The government cannot be in every house, cannot be in everybody's, doorstep to ensure that you obey these regulations. They are meant to protect ourselves. And even if you look what's happening in other countries, it is supposed to be natural. So for those who do not understand, it is your responsibility really as members of the press, of course, working together with government to ensure that there is compliance, there is understanding, and people obey these regulations for the good of the country. Indeed, even you members of the press, you need your clients, you need your customers, you need to continue, maintaining a client base. If 50% of them are sick, it will not serve you any purpose. And therefore, you're also duty-bound to consistently keep on educating them about the importance of obeying these regulations.
All right, and I have Michael Agwanda here, who's a governance consultant. I think he also has a question for you, Michael.
Colonel Guna, I just have one question for you. When Michael asked you about specifically people writing comments and saying that they actually passed those roadblocks, your answer was that some of these cases are not authenticated. Don't you think where there is a smoke, there is fire? And wouldn't you actually address this in a manner likely to give hope to Kenyans who think that those borders are porous and therefore that you need to put more emphasis on the individuals that are managing these roadblocks to do their work than just dismissing it that they're not authenticated.
No, Michael, let me tell you what. Every, county borders, especially counties that border Nairobi, they have got many, many crossing points. But indeed, our police officers who are manning this, including GSUs, are doing a stellar job. So when somebody crosses, through any of those unofficial crossing points, it is not appropriate to point an accusing finger at the law enforcement officers who are doing a stellar job. They're doing extremely well. But it also upon ourselves, Mr. Michael, that our people must also understand why these regulations have been put there. We are 47 million Kenyans, and there are about maybe 50 to 100,000 police officers. So if you take a ratio of that, you can realize that the police officer cannot supervise every Kenyan. It is every Kenyan who must supervise himself and herself. These regulations are aimed at protecting their well-being. And therefore, this well-being here means that our own personal health, safety, and security. And that starts with me, not with the police officer who is supposed to enforce the law. It is me whom I must understand the importance of me to obey those regulations. At the end of the day, it is my life, my family's life, my friend's life. Once it is gone, it is gone. And therefore, I am duty-bound to protect it.
All right. And of course, one of the other questions that many Kenyans have, particularly those who earn a daily wage, is what are we supposed to do when we're supposed to stay home? Yet there are those who may not have basics, even food, for example. Yet the advice from the Ministry of Health is stay home, stay safe. What would you say to them?
The government has not at any one time said that the people should never work. The government said that for those who are able to work from home, please work from home. And they went further that if you are 58 years and above, because of what has been observed in other jurisdictions, is that you are more vulnerable and therefore you're supposed to stay at home. But the others must go to work. That has been very, very clear, right? But we also understand because of the realities of this infection and this virus, some companies, some hotels, some enterprises have been closed down, right? And that is why the government did enhance the social protection program to be able to incorporate some of those our members of our society that their businesses have been impacted on negatively. But to the extent that the government has stopped people from going to work, that has not happened.
All right, and maybe just your closing remarks and what you would say to those Kenyans, particularly because I think majority of Kenyans have taken this seriously. Majority of Kenyans are following the guidelines and the rules given by the Ministry of Health and World Health Organizations, but we still have a few elements, like we've mentioned, those who are trying to, just circumvent the restrictions put there. What would you say to those few? Because those could be the ones who will end us, who will keep us, in this state for longer than expected.
Really, mine is to ask them that this is not something that a campaign that can be, carried out by the government on its own. It's a campaign that must involve the whole of the society. All of us must pull together. All of us must come together, and be able to obey those regulations. Because indeed, like you rightfully said, if a section of our society is not obeying those regulations, our campaign will be long drawn, and that curve will take a long time before it can be flattened. And who knows? It might be one of you, of those people who are not obeying regulations, who may, catch it, and God knows, he might probably just die. And therefore, what I'm asking that let's all pull together, let's all pull in the same direction, let's all observe, where we want to go, and then have a strategy, which, of course, is headed by the government on how to get there. And therefore, for those who are at home, for those who are working, please obey social distancing. Please wash your hands using soap for 20 seconds and ensure that if you're not able to work at, from normal office place, please quarantine. And even as you quarantine, observe social distancing.
Thank you very much, Colonel Cyrus Oguna, for joining us this morning. That's the government spokesperson, of course, underscoring and highlighting the importance of following those WHO and Ministry of Health guidelines to ensure that we flatten the curve. But also with me in studio, we have Michael Agwanda, who's a governance consultant. And Michael Agwanda, looking at some of those messages I've read of Kenyans who feel that, the authorities maybe are not enforcing as much, but even as the government spokesperson mentions, it is more our responsibility now collectively, not just the government.
Mike, I want to applaud the good job that the government spokesman, Colonel Oguna, is doing. I want to applaud his ability to communicate on matters of COVID-19, and the entire Ministry of Health is doing. I also have to say that it is indeed the responsibility of every Kenyan to make sure and to be aware that the disease is alive and it's out there, and if we don't protect ourselves from it, we're going to catch it. We do not have to learn from the moon or from the sky. We only need to learn from the countries that are already hugely affected with this corona disease. We know that America is now leading in number of deaths. We know that China has had a huge issue. We know that Italy has had a big issue. We know that many other countries in Europe are having huge issues with coronavirus. Africa has not been hit that bad, but that does not mean that it's not coming, and it's coming in a big way. However, on the matter that we are discussing today, I think the message that is supposed to be sent out to the people is perhaps what has not gotten into the people. I think when you read from the Ministry of Health and the Minister and of this, of course, CAS, talking about conditions that need to be in place, the emphasis is not so much on what you need to do as an individual that need to be careful about this disease, but more or less like what the government wants you to do. I say this because if you look at our leadership structure, it's not only the executive that people listen to in this country. People don't just listen to the minister or the CSO or CS or the Ministry of Health. People listen to their pastors. People listen to the elders. People listen to the chief. People listen to the community health workers. People listen to some people that are around them with some authority and some trust level than the big government syndrome. This is what the government is saying, and this is what you have to do. That's good enough. People listen to the politicians. People listen to the MCAs and MPs, and people listen to the senators. Of course, when you look at the political class, now the complaint that we have is they've disappeared, either under quarantine or sick or for whatever reason, because nobody seems to be hearing where they are. But people trust some of these people. And the question, therefore, that I wanted to ask is, why are we not involving the local leaders, the people that are trusted with the leadership in the community, to be involved in one-on-one discussion on these matters with the people around them? That, to me, is going to send huge messages to the local mwananchi on the grassroots than hearing it from TV or radio every briefing time.
Every briefing time. And maybe that now bring in my next question and what I'd like us to highlight. And this is our legislators. We have the headline this morning on the Standard, the traitors. The legislators, particularly members of parliament, would have expected some action right now, by now, one being looking at legislation that is going to cushion the mwananchi, particularly for the harsh times that are ahead. Because even if COVID-19 ended today, right now, and we declared it finished, we still have a ripple effect of the economy that needs to recover. It was already, literally, throwing kicks in its deathbed, but here we are now. But we've had nothing come from the legislators. As a governance consultant, what is it that you'd have expected the legislators to have put in place by now?
The president has announced a lot of measures. He's reduced VAT, pay as you earn. He's actually increased the limit up to about 24,000. If you're earning 24,000 now, you're not supposed to pay as you earn. There are a lot of measures that have already been taken that is supposed to be done by Parliament. But during circumstances like this, which we call an emergency time, the president can announce this thing. But it requires a legislation. It requires a law to be passed in Parliament so that this thing can come to effect. Now, what we've seen lately is the members of parliament have been nowhere and everywhere. In other words, nobody really knows where they are, but they are somewhere in this country. They don't talk as much because the rallies are not there. Neither do they attend parliamentary sittings. In fact, I don't know when last parliamentary meetings were done. And the only thing we see on the news is when the Speaker of the National Assembly and the Speaker of the Senate, sit together and make some announcement, basically. But you don't see members of the Senate and members of the National Assembly coming and endorsing or supporting or passing bills in ratification to the measures that the president has put out there. That should have been the primary role of the committees in finance, the committees in health, that we're not hearing from. We will expect the committee's chair of maybe health and finance being involved in this discussion, in a very steady way. But we don't hear about the chairs of these committees, relevant committees. We don't hear about the members of those committees. We don't hear about the parliamentarians. In fact, somebody joked and said, until the other day, when there was scuffles of leadership in Jubilee this weekend, that's when we had some few members of parliament talking. But now, something that is affecting Kenyans like COVID-19, we know that Kenyans are already losing their jobs. We know that many Kenyans are not able to pay their rents. We know that many Kenyans will not be able to put food on their table. We know that many Kenyans are not able to travel at this time. This, as many countries out there, if we look, for example, Ghana, which is in Africa, the president is upfront, not just on issues of cutting, the cost, ensuring that there's enough food in the country, ensuring that the electricity is not paid, and ensuring that water is not paid. No. Our people are not there. It's like they're not representing anyone. If we have issues, it is everyone for himself. But when we want to discuss issues of remunerations and salaries in this country, then we all find ourselves in parliament. Unfortunately, that's what it is. But as I mentioned a little bit about, like ensuring that these three counties that we are having, that are locked up as the government has advised. Mike, this is it's good for all of us. The reason why it's good for all of us in terms of governance and in management of this COVID-19 is, one, you need to be able to early identification of the cases is a key thing. Then early quarantining of the cases is another. Remember, early management of these cases saves life. Early tracking down of contacts is key, because if you don't, these people will have contracted the disease and they'll be full-blown, and managing it will be very difficult. And so early identification, early quarantine, early tracking of these people, early treatment, early management, early statistics that we are talking about in terms of how many people have been tested, what are the test samples that were there, against which people. This is why mostly, I know it's not coming out from the government, but this is why we will lock Nairobi, we will lock Kwale, because there are cases that are happening there. There are cases that have been confirmed to be positive, and as a result, if the tracking is done on time and treatment done on time, then we can limit the spread of this disease. And so the Kenyans need to know that movement from the counties that are already, identified as COVID-19 cases is a risk not only to them but to their families, to the people they're interacting with, and to other counties that we don't want it to spread to. Until Kenyans know that, then they will stop. Myself, my wife is actually stuck in Kisumu, and I'm in Nairobi, and I have kids in Nairobi, and
right now you have to play the role of father and mother for them.
It was a good decision that indeed that is observed for the interests of this country and for the interests of our families as well.
All right. One of the other things, of course, that we are likely to never go back to is how we do things. For instance, business, we've been forced to become very innovative. And do you feel that even even our politics is likely to change after this? I would have expected that by now that our legislators, for instance, a very simple act of kindness would have, or not even act of kindness, responsibility would have been to slash their salaries, which has not happened. But do you see this changing the way we do politics?
Mike, we have a very greedy political lot in this country. Give it to the president, give it to his Senate, give it to the deputy president who said, the Speaker of the National Assembly, as well as the Speaker of the Senate. I can tell you that we have a very self-centered political individuals in this country. And this sprouts from the insincerity of the electoral process in this country. It sprouts from people buying tickets to a political party to become an MP or a governor. No, I'm not saying all of them. It sprouts from people using a lot of money, and some of this money they want to recoup back. It sprouts from an individualistic way of looking at things. It sprouts from a system where if you're an elected leader, you think that you're above everybody, and therefore people need to listen to you and you cannot listen from them. And I think that's a problem we're having in this country. It is unfortunate that in UK, where we have even higher numbers than here, in the US and in many other European nations that are much wealthier than us, are sitting in parliament and discussing this matter of health and giving rough measures on how they can stop the spread of COVID-19. Not just to individuals like the executive I'm seeing, Minister of Health, but in Parliament discussing and supplementing or helping the enforcement of health, Ministry of Health statements out there. Right. We've seen the President talking in the United States almost every day. If it's not on Twitter, he's in public. If it's not, he's addressing, because this is an important matter. I wonder where our politicians are. Now, is it going to make things difficult? I mean, different for our political class? I guarantee you, even those politicians that are used to giving goodies, they fear going on the ground because they think that if they go on the ground, they will expose themselves and they'll have COVID-19. And for that reason, they don't want to go. People are going to judge them harshly because when they were needed to be with their people, they never. When they were needed to make laws that will cushion the suffering Kenyans, they never did it. When they were needed to talk about the people that have lost their jobs, we've seen in other countries, basically, of course, they will have more money than we do. But if you've lost jobs, the government has rolled out money there that will be able to cushion employers and to cushion employees that have lost jobs. And for that reason, they'll be able to get some stipend. These are some of the things that need to be discussed in Parliament. But because Parliament do not want to be seen, neither to be heard at this time, they will be judged harshly. Of course, a trend in this country, we know that about 70% of parliamentarians or senators never go back to Parliament. It might be more, perhaps even 90% of this time of them will not be able to go back.
Of course, the question is, what quality of breed of parliamentarians and politicians are we going to put back there? Because really, this is just a selection of our society. We get leaders that are a selection of who we are. But maybe as we conclude, your word of advice to Kenyans as we're getting to a very critical moment. Given the predictions and the numbers which are now being queried, it is expected that if we follow the trend as per the statistics for other countries that are ahead of us in regards to COVID-19, we're expecting maybe even over huge numbers by the end of April. Although so far, hoping that our systems are working well, we seem to have to be less in terms of numbers. But what advice would you give to Kenyans, given that we're at a very critical moment?
I will advise Kenyans and our brothers and sisters that let's observe what the government has actually ordered us.
It is for our own good.
It is for our own good, number one. Number two, if we are supposed to use the mask, I think let's use the mask properly. But I also implore the government that please provide the mask. If Jack Ma donated several million masks in this country and other equipments. Let's avail those equipments to be used by medical officers. If you look at this case in Siaya, where a gentleman walks into the hospital and is treated, is even admitted in the hospital on Friday, in the hospital, and I believe the doctors there did not take the measures that they needed to take, in regard to protect themselves, just in case this man could be sick of COVID-19. So I really think that as a country, as our health workers out there, let's protect ourselves as much as we can. We may not have the resources that are needed, and of course the government need to provide this, but let's also know that it's our responsibility first, and we should not expose ourselves so much. And if we do, we'll be exposing our families. I also think that if we know for sure, the reason why we're having even a bigger problem in many, many countries is stress in the contact. I think it is proper that if we know of an individual that was even suspected to have been COVID-19 case, we need to avail ourselves. But the government must also stop from threatening people who want to avail themselves. Like I saw the county commissioner of Rift Valley saying, you need to come by Friday. If you don't come by Friday, we will arrest you. It is not about arresting people, but it's about ensuring that this disease does not spread, does not even spread to the policeman who wants to arrest people. Look at the case in point where the cops were arresting individuals that were in a bar. They didn't care about themselves. Yes, you might be the arresting officer, but you also need to know that you're not immune to COVID-19. If they bundled them the way they bundled them in one vehicle, what they were trying to tell the world is we don't care whether you catch it if one of you has it, because you are already breaking the law. But they didn't know that they were actually going to border the same vehicle that they were bundling these individuals into. They also need to know that as a country, if we are told don't go to bars and drink, we need to stop doing that. Just to stop this disease. It costs money. It has cost jobs. It has cost life. Money, jobs, and life. What else do you want but to stay home or to ensure that you just don't interact where you're not supposed to be?
All right, thank you very much, Michael Agwanda, for joining us this morning. But let me just read a few comments that are coming through. And there is William Buru who says they aren't the greatest problem. We have, is the CS always talking and searching those whom were in contact with the patients and they will heal. To the contrary, somebody here, Mateo, says too little, too late by government. Remember, the question that we had asked is whether the restrictions that government has put in place, especially the inter-county movement that has been restricted in several counties, namely Kilifi, Kwale, Mombasa, Nairobi, are effective. You have Jonathan